Propranolol is what I will discuss in this video. And propranolol is a medication, and it's a non-selective beta adrenergic receptor blocker. So what does all this mean? Well, the non-selective part means that it blocks both beta-1 receptors and beta-2 receptors. We have selective beta-1 receptors available, and they are atenolol and metoprolol. These are some examples. But what we're talking about in this video is propranolol, and propranolol blocks both. Beta adrenergic receptor is just referring to the receptor, and blocker just means that it antagonizes those receptors. So when that does happen, what effect does it have? Well, beta-1 receptors are on the heart, and beta-2 receptors are on the lungs. And the way I remember it is that we have one heart, but we have two lungs. So that's how I remember which receptor goes where. When you block a beta-1 receptor, the result is that you decrease the heart rate. When you block a beta-2 receptor, the result is bronchoconstriction. Now what we want is this, but we unfortunately get this as well. But we'll talk a little bit more about that later. So what is propranolol used for? Well, it's used for a lot of things, but by far one of the biggest uses is treatment of high blood pressure, hypertension. And the way it works is that it decreases the cardiac output, because cardiac output has a special formula where cardiac output equals stroke volume multiplied by the heart rate. Now when you use a beta blocker such as propranolol, it blocks beta-1 receptors on the heart, and that results in a decreased heart rate. So when you decrease the heart rate, you also decrease the cardiac output, and as a result the blood pressure goes down. Another use for propranolol is any type of arrhythmia, in particular tachycardia. And it works really with ventricular tachycardia, very simply because it decreases the heart rate, and tachycardia by definition is increased heart rate. There's many others such as migraine and tremor, things that you can use propranolol for, but by far hypertension is the most common reason. Now let's get into some things that are commonly tested on the licensing exams, that is contraindications. What scenario should you not use propranolol? Well, there's two that I really want to emphasize. The first one is anyone who has asthma. Why? Because propranolol, remember, blocks beta-1 and beta-2. When you block the beta-2 receptor, you get bronchoconstriction. And you don't want bronchoconstriction in someone with asthma, because someone with asthma already has bronchoconstriction. So you can throw the person into even worse situation of asthma, exacerbate their asthma. So avoid propranolol in someone who has asthma. Another situation in which you want to avoid propranolol is with diabetes. Now why is that? The reason is a diabetic can sometimes go into a state of hypoglycemia, which means they have low blood sugar. By definition, diabetics, have high blood sugar, but sometimes because they're not eating properly, or maybe they took too much medication, they can go into hypoglycemia. A normal person in a state of hypoglycemia will have certain symptoms that let the person know that he's probably in a state of hypoglycemia. And one of those symptoms is that the heart rate will rise. But if someone is on propranolol, their heart rate will not rise because the propranolol medication is decreasing. So what that does is essentially masks the symptoms of hypoglycemia. And that can be dangerous because the patient heart rate is normal, so he doesn't feel the pulse rate rising, so he's not really being informed by his body that he's in a state of hypoglycemia. So that can be very dangerous. So avoid propranolol in those two situations, asthma and diabetes. Now I want to talk a little bit about some side effects that can happen. There's 3 or 4 that are really common in terms of testing and in real life. The first one is severe bradycardia. Simply that means is that the heart rate is just too low, and that's direct effect of the medication because that's what propranolol does. The next one we talked about a little bit already is bronchoconstriction or bronchospasm. Another one is a sexual side effect, which is loss of libido, and that's commonly tested on licensing exam where a person starts this medication and then all of a sudden complains of loss of libido, loss of sex drive. And then another one is depression. Propranolol is one of the most common causes of drug-induced depression. Symptoms such as poor concentration, fatigue, insomnia, all the characteristic findings in someone with depression. So keep those in mind. So now let's take a look at some vignettes. 66-year-old woman comes to the office because of difficulty sleeping, decreased appetite, fatigue, inability to concentrate, and general down mood for the past 2 weeks. She states that she and her husband are going on a 3-week trip to Italy and France, and she wants to get to the bottom of this before they go. She has been coming to you since her first child was born, and over the years you have treated her for gastroenteritis, yeast infections, and most recently, high blood pressure. She always has been very compliant. You notice in her chart you prescribed propranolol for hypertension 1 month ago, and after trying to control it with weight reduction, smoke cessation, alcohol elimination, salt and fat reduction, and exercise. Her blood pressure at 3 previous visits was 150/90, and today it's 135/80. She does not take any other meds. At this time you should. Well, she's been talking about all these symptoms of depression, and this is happening for the past 2 weeks, but just 1 month ago you started on propranolol. So propranolol has not suited her well in terms of blood pressure medicines causing a side effect of depression. So advising her to stop taking the propranolol and giving her another blood pressure medication is probably the best choice. Next question. 32-year-old woman comes to the office for a prescription of propranolol for stage fright. She tells you that she's a professional singer and lately she has been experiencing butterflies and palpitations before performances. She has been so worried about having one of these symptoms that she is having trouble sleeping at night. She tells you that a friend of hers has had a similar problem and propranolol has cured her. She has been a patient of yours for the past 10 years, and you remember that she has severe asthma requiring many hospitalizations, the most recent being 2 weeks ago. Her asthma attacks have been increasingly more severe and have been occurring at increased frequency. She tells you that she is in a rush and all she needs is the prescription. Most appropriate next step is, well, remember, one of the contraindications for propranolol is people with asthma. So the best thing to say is, sorry, but propranolol is not a good drug for you because you have asthma and propranolol can cause bronchoconstriction. Best is to use something else to treat her stage fright. And finally, a 43-year-old insulin-dependent diabetic is diagnosed with hypertension and begins therapy with an antihypertensive agent. 3 days later, he measures his blood glucose at home and finds that it is 53. He recalibrates his glucose testing apparatus and repeats the test, only to find that the first reading was accurate. He is concerned that his hypoglycemia did not produce the normal premonitory signs and symptoms. Which of the following medications was most likely prescribed to treat this patient, treat his hypertension? Well, this is an excellent question where you have a patient with diabetes who has hypoglycemia. But normally, a patient with hypoglycemia would produce certain symptoms, and one of those symptoms is increased heart rate. But he never actually experienced that. He never experienced the rapid heart rate or rapid pulse. And the reason is because he was placed on propranolol. And propranolol, what it does, it decreases the heart rate. So his heart rate is probably normal. So essentially what this does is it masks the symptoms of the hypoglycemia. And that's dangerous because those symptoms are needed for the patient to be aware that he is indeed in a state of hypoglycemia. So propranolol is contraindicated, and that's probably what was used to treat his blood pressure. So he definitely needs to be taken off the propranolol and be given some other medication, such as an ACE inhibitor, such as captopril, if you were to give a new medication.